Has your child had ear infection after ear infection, and you're wondering if tubes might finally bring some relief? Or maybe your pediatrician mentioned that there's some fluid in the ears that just won't go away. Maybe you're worried about hearing loss or even speech delay. Today, I'm going to break down exactly when it's time to think about ear tubes for kids. We'll talk about what the signs are, what the medical guidelines say, and how to have the right conversation with your ENT doctor. Stick around because by the end of this video, you'll know whether your child might benefit from ear tubes or whether it's safe to wait. Hi, I'm Dr. Ashley Agan. I'm an ENT doctor, and I help kids and families navigate ear, nose, and throat issues every single day. And just so you know, this video is for education purposes only. Always talk to your child's doctor for personal recommendations related to your unique situation. Okay, let's get started. What are ear tubes? So ear tubes are tiny little cylinders placed across the eardrum, and their job is simple: let air in and let fluid out. Why do we use them? Well, they reduce ear infections, they help kids hear better in situations where there's fluid, and they improve quality of life. Better sleep, fewer antibiotics, clearer speech. And here's some reassurance. This is one of the most common procedures done in kids. It's quick, it's safe, and it's very effective. My own child had ear tubes placed, and I can tell you firsthand, it was a game changer for our family. Okay, when to consider tubes? When should you actually think about ear tubes for your child? There are 4 main situations. So, number 1, recurrent ear infections. And that means 3 or more in 6 months or 4 or more in a year, especially if antibiotics aren't helping or if the infections are severe and resistant to antibiotics. Number 2, chronic fluid behind the eardrum. If fluid is trapped behind the eardrum, it can cause a temporary hearing loss. Imagine what it sounds like when you're underwater. When you have water in your ears, sounds are muffled. And if it lasts more than 3 months, it can lead to speech delays or even behavioral issues. So that's when we might want to think about placing tubes. Okay, number 3, hearing or speech concerns. If fluid is affecting hearing and your child is falling behind in language, we take that very seriously, especially in kids under the age of 3. That age is when speech development is exploding, and it's a critical time for language development, and we want them to be hearing at their best. And then number 4 are other special circumstances. For example, kids with cleft palate, Down syndrome, vision loss, or developmental delays. They may need tubes earlier. And if a child has had serious complications from infections like mastoiditis or an abscess, that's another reason why we might move faster to put in a tube. Now, what if you're not sure? The truth is, not every child needs ear tubes right away. And sometimes we do recommend what we call watchful waiting. What is that? It means we wait and see, and time will tell. And here's some scenarios where we might wait. So if the infections are mild and respond to antibiotics, if we are heading into warmer weather or summer months when respiratory infections are less common, meaning ear infections are also less common. If the fluid has only been there a short time, so less than 3 months, we can wait and see if the fluid resolves with time. And for many kids, it will. If the child has had a hearing test that shows that there is no hearing loss or only mild hearing loss, and there is no concern for speech delay, we could potentially watch and wait. But here's the key. Follow-up is critical. If there's fluid, it's important to ensure that it resolves. If there is speech delay, checking your child's hearing is one of the most important steps to be able to know whether hearing loss is contributing to speech delay. If your child does need tubes, here's what to expect. It's a quick outpatient procedure done in either the clinic or the operating room. Kids bounce back fast. Many are back to normal the next day. The tubes stay for about 6 to 18 months, so big range there. but typically fall out on their own. And for most kids, tubes mean fewer infections, better hearing, better sleep. It's better for everyone. The whole family sleeps better. So let's recap. Think about ear tubes if your child has frequent infections, fluid lasting more than 3 months, or if you're concerned about hearing and speech. And if you're on the fence, ask your pediatrician for a referral to an ENT like myself. We can check your child's ears, refer them for hearing tests if that's needed, and talk through the options. And if you want to come see me here in Dallas, visit scottyent.com to book an appointment, or you can give us a call. I would love to work with you and your little one to get on a path to a better quality of life. And if you found this video helpful, go ahead and hit that like button and subscribe, and let me know in the comments what questions you still have about ear tubes. I would be happy to cover those questions in future videos. Thanks for listening.